And welcome back to Local 6 Midday, visiting with Dr. William Walden of Paducah Dental Care on this edition of Family Health Experts, entertaining your dental questions at 1-888-208-6946. And Dr. Walden, before we get into some of the questions for today, your oral health is connected to your overall health, is what everybody seems to say. Now, how can bad teeth be connected with heart problems?
Well, you know, they've been looking at the association with that research for the last, probably 10 years. And so they're finding some specific bacteria that's in the oral cavity. They're finding it around heart valves and in inflammation of the heart. So does that mean if you have gum disease that you're going to get heart disease? Not necessarily, but they're finding some associations there. So they're taking it very seriously.
So who exactly would be at risk for that development of maybe heart disease if they do have bad teeth?
Well, you know, gum disease itself, they used to like to say it was kind of like high blood pressure. High blood pressure has always been called the silent killer. Well, you have gum disease and you don't know it because nothing's hurting until it gets advanced, and then you have your gums shrink away, the bone starts to erode away. So it's a great big trash can for bacteria and for debris. And so the inflammation and the bacteria, of course, it's in our bloodstream, and so this can go to, you know, the heart or anywhere in the body. And so people who are diabetics, people who are overweight, and just general poor health can, you know, all be in the same thing as being, you know, in a state where you can get heart disease or gum disease.
I have a question from a viewer who says, my gums seem to be pulling away from my teeth. What can be done?
Yeah, well, you definitely need to see your dentist. If they're pulling away, then you've got some gum disease there. It can take some what they call scaling and root planing or deep cleanings, some antibiotics, some mouth rinses, and in having your teeth cleaned, you know, every 2, 3, 4 months. So definitely want to get to see your dentist.
Another viewer wants to know, how long does it take to start eating on an implant? And I'm assuming here they're talking about after it's implanted. How long before you can eat?
That's a real good question. So, you know, if you have the implant put in and it's you're going to have a cap put on it, then usually the implant has to integrate into the bone before you start chewing on it, which is 3 to 4 months. Now there's some new technologies and stuff where they're trying to get it to be quicker, but the standard is usually wait till you have integration with the bone, so you want to wait. Now they've got some, you know, if you're attaching it to a denture, that can be a little different. So with the denture, sometimes you start using it and chewing with the denture immediately.
Now, I'm assuming here, doctor, that it's not that you cannot eat. You just may have to alter your diet to
where. Right. You can eat, but you don't want to activate the implant. So that's why a lot of times they'll keep the implant, what they call, out of your bite or still under the gum, where when you do chew and eat, you're not putting pressure on the implant.
A lot of other dental questions that you may have may be answered in a special 30-minute program on a programming note that's coming up here in about 10 minutes at the bottom of the hour. Dr. William Walden, Dr. Matthew Mangino from Paducah Dental Care, a full half hour answering your dental questions. If you'd like to review this segment, you can do so very shortly online. Look under the family health icon at WPSDLocal6.com.